Good afternoon, everyone. It's Rob here from Nutridyne Europe. I'm really excited to be bringing back Dr. Robert Silverman, who will be presenting the Essentials of Nutritional Medicine series. So over the next several months, Dr. Silverman will be presenting several essential topics which will benefit your practice, your patients, and yourself, and you'll be able to use information pretty much straight away. So today's lesson 1 on gut health. And like always, if you have any questions throughout the webinar, please just use the question box at the bottom, and then I'll be popping back on at the end to go through your questions with Dr. Silverman. So I'll now pass you over to Dr. Rob, who will get us underway. Thank you.
Thank you so much, Rob. We got a lot of Robs going on here. I'm very excited to be able to share all this information. We've got 8 different webinars. It's building towards a crescendo. As I take you through the science, I'm also going to show you the ease in which you can implement the science and any ingredients, products that you need, any case studies. As you can see at the beginning and the end of every webinar, I'll have contact information. So you can always reach out and contact me. And of course, you can always reach and contact Rob. And I thought the best one to start with was the gut. 80% of your immune cells are in your gut. It's where your macro and micronutrients are. So let's start with the gut. And I think as chiropractors, if there are chiropractors out there, they're going to find out how valuable looking, analyzing, treating the gut will be for musculoskeletal injuries. Nutritionists, it's a great way to start. And all other medical type practitioners, it's a great add-on because so many people ask for drugs, and there is, unfortunately, when you take medications, a little bit of a gut-drug interaction. We can try and save 5 minutes at the end to answer any questions. If we can't get to your questions, just send them in to Rob, and we'll work on it. So without further ado, let's talk about Inside Out Health, a revolutionary approach to your gut. I always like to start everything with a quote. I think this is probably one of the most famous quotes when it comes to gut. It's Hippocrates, and he said, correctly, all disease begins in the gut. So every time I lecture, you will see this slide or a slide like this, because this really encapsulates everything that we want to talk about when it comes to gut health. And it really talks about how the systems in the GI system really interconnects with all other systems. There'll be derivatives of this. We could expand on this. But as you'll see, the gut, without question, is intertwined with so many systems, organs, and such. One thing missing right here, and of course, we'll cover it in some of the succeeding webinars, is the gut's interaction or interconnection with the immune system. But let's keep it real easy. Let's take a look at the gut. 80% of your immune cells are in your gut. It's where your macro and micronutrients are absorbed. When we talk about the gut, we're talking about the large and the small intestine. The small intestine is about 90% of the length. It's sort of a misnomer. They call it small, but it's so long. They call it small because its diameter is 1 inch as compared to the large intestine's diameter, 2.5 inches. In addition, the small intestine's barrier, epithelial cell lining barrier, is the thickness of a wet paper towel, whereas the large intestine is a triple epithelial layer. So obviously things can pass from your small intestine through your gut much easier than from your large intestine into your bloodstream. And let's make note of that. Your small intestine's purpose, its function, is to allow digested food particles, vitamins, and water to be absorbed through its barrier into your bloodstream to feed the body. However, when your gut becomes too permeable, damaged, or leaky, as we like to say, specific things can pass like undigested food particles, parasites, bacteria, fungi, and of course, the good old virus. When they pass, your body's immune system has to react. And unfortunately, by it reacting many times in people who are not in perfect health or immune system are in perfect health, who do not have or have these comorbidities, that is where the injuries start to ensue. So when we look at this, what causes a leaky gut? Well, leaky gut can be caused by a multitude of things. On this slide, we're going to talk about yeast and fungus and overgrowth, food sensitivities. Food sensitivities can damage your gut, and you can have food sensitivities if your gut is damaged. But one of the biggest and easiest things to discuss is something called dysbiosis. It's unleaveling of good and bad bacteria. Good and bad bacteria. Bacteria is a critical element because it populates and communicates health with your immune system and with your central nervous system. Having said that, dysbiosis or unleaveling of good and bad bacteria usually does not occur when you have good bacteria to the tune of about 85% of the population in the gut. Say that again, about 85%. So if we don't, it's very common to have leaky gut. Some of the things that can occur when you have leaky gut is the expression or the release of that red guy there called LPS, lipopolysaccharide. Lipopolysaccharide is an endotoxin. It holds gram-negative bacteria on the inside of your intestinal wall. The LPS is actually hanging on the outside. It's sort of like ivy on the wall. If we have an increased incidence of leaky gut, we have an increased incidence of toxic and chemical overloads to your liver, leading to liver dysfunction. So your gut and your liver are intertwined, and they should be considered almost one unit. When we have an increase in leaky gut, we have an increase in blood sugar problems, insulin resistance, prediabetes, and diabetes, hence the idea of insulin. And insulin resistance poses an issue in most people. Increase in body composition, or if you will, obesity. When you have an increase in the amount of leaky gut, you have more autoimmune issues. More times the body will attack itself. Thyroid is implicated there. Leaky gut, leaky heart. 3 times the incidence of heart disease if you have the expression of LPS in your bloodstream. And please make note, leaky gut releases excessive amount of cytokines, leads you to a cytokine storm. MMPSs, matrix metalloproteinases, your body's own proteolytic enzymes released at the time of injury. All of this can damage your musculoskeletal system, causing arthritis, joint pain, and soft tissue pain. And last, but of course not least, your gut-to-brain axis. Bidirectional gut-to-brain axis. Whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. So let's look at what a healthy gut looks like. There's a perfectly pristine gut with its microvilli, those shaggy extensions. The white balls are digested food particles. The blue balls are undigested food particles. And when you see you have healthy cell junctions and good villi, all that goes through the gut is digested food particles because they're small enough to go through, whereas the blue ones, which are undigested, are unable to go through. However, when you have leaky gut and you have openings, you'll now see both undigested and digested food particles going through. Those undigested food particles are deemed an antigen, and your body has to respond. Your immune system goes on alert. So somebody once famous said, the gut is not Vegas. What happens in the gut doesn't stay in the gut. Leaky gut. With leaky gut, damaged cells in your intestines don't produce enzymes needed for proper digestion. Therefore, your body cannot absorb essential nutrients, leads to hormone imbalance and a weakened immune system. So if your gut's damaged, many people always complain about being hungry. In addition to that, there are those hormone imbalances, and we've kind of indicated earlier that there's a weakened immune system. If your immune system isn't in perfect working order, it will definitely fail quicker. So LPS, lipopolysaccharide, induces mitochondrial DNA, which contributes to the NLRP3 inflammasome. The reason I put this slide in is that NLRP3 has been implicated so highly now with the COVID-19. So let's just take a step back and see what happens. When LPS is expressed from the gut, it hits something called toll-like receptors. Many of these cells, especially a gut cell, has this receptor. This receptor then stimulates an innate immune response. It's not a positive one. It stimulates IRF1, which stimulates NF-kappa B. NF-kappa B is the signal pathway transducer of inflammation, which ultimately stimulates interleukin-1 beta through the NLRP3 inflammasome. In addition to that, toll-like receptor also stimulates CMPK, which actually damages the mitochondria. Damaging the mitochondria gives you a lack of energy and gives people a symptomology of fatigue. So when people complain that they have fatigue, many of the conditions when they do complain about fatigue lead me to believe that they have some sort of gut permeability or gut damage. I think this slide really explains well the idea of leaky gut versus not leaky gut. When you look at the left, you see the tight junctions in perfect condition, whereas the leaky gut, you see microorganisms, gluten, and toxins passing. As they pass this leaky gut, they're able to burrow themselves through the mucosal membrane cells. They then are present in your bloodstream. Your body has to respond. They do so by releasing ultimately B and T cells in your adaptive immune system, which releases IgG, IgA, and IgM. When you have this immune system response, you can have all these other ultimate responses, which are nutrient malabsorption, autoimmunity, food intolerances, blood-brain barrier breaches, and systemic inflammation. So here are a multitude of things that can damage the gut. This list doesn't encapsulate everything that can. Here we have stress, the gut microbiota composition, toxic chemicals, medications, inflammatory cytokines, undigested food particles, lectins and agglutins, food colorings, and believe it or not, chewing gum. They break down your mucosal and tight junction, allow permeability, which ultimately leads to intestinal barrier dysfunction, food allergy and intolerances. Again, do you have a food allergy that damages your gut, or do you have a food allergy after? We're not really sure. Ultimately leading to immune system abnormalities. Next step is autoimmunity. Unfortunately, autoimmunity influencing the blood-brain barrier. Damaging the blood-brain barrier leads to neuroautoimmunity, a great example of things that damage a gut that can also damage the brain. Medications that can contribute to leaky gut. Antibiotics. Here in America, we use a ton of antibiotics. Kills all bacteria in the stomach. NSAIDs, non-steroid anti-inflammatories, they also damage the microflora and can also injure tight junctions. NSAIDs, Aleve, Advil, ibuprofen, they are what I like to refer to as a non-starter or a no bueno, if you will. Birth control pills lead you down a path of increased estrogen, which lead to candida growth. Steroids actually unlevel the immune response and actually lead you down a path of perpetuating autoimmunity. And antacids, which lead to gastric acid or chronic gastric suppression. If you're not able to digest your foods, you're probably going to get bacterial overgrowths and some gut infections. Gut on fire means brain on fire. Brain on fire means gut on fire. Whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. If you feel gas and bloating after you eat, that's your gut's way of explaining to you that you have a digestion problem. After that, if you have a brain fog after you eat, it's your body's way of saying that your gut's on fire and your blood-brain barrier is compromised. There are no pain fibers in your gut. The only way your gut can tell you that it's having a problem with digestion is to give you gas and bloating. There are no pain receptors in your brain. The only way your brain can tell you that you're having an issue is to have a slow neurological response, which feels like lethargy or brain fog. There's also some other ways when you look at the symptomology. So we call it silent leaky gut, silent intestinal permeabilities, possible loss of tight junctions, ultimately leading to systemic inflammation. The symptoms are clear: depression, chronic pain, fatigue. You get endotoxemia, which leads to the release of LPS, which activates brain inflammation, can lead you down a path of depression. An overactivation of microglial cells. Your microglial cells are your immune cells in the brain. They have now begun to function aberrantly in this scenario, and systemic inflammation activating in each area. All those who do musculoskeletal injuries, chronic pain, and LPS damages the mitochondria, as I indicated earlier, leading you down a path of fatigue. Here is a beautiful slide example of damage to the gut where gram-negative bacteria or pathogenic bacteria can be expressed and not necessarily the same. LPS and amyloids are released, passing the GI tract barrier, leading to systemic inflammation, passing the blood-brain barrier, leading to neurodegeneration in central nervous system compartments, and also amyloid in the brain. And as we all know, amyloid plaquing or amyloid buildup in the brain leads us towards Alzheimer's. There is a direct gut component to Alzheimer's disease. Autism risk determined by the mom's gut health. So believe it or not, mom's microbiome determines the risk of autism. and other neural development disorders in the offspring. So therefore, the possibility of autism could be prevented by altering the mom's diet and gut health. The role of gut microbiome in autism, there's a definitive gut relationship because the gut alters immune system and metabolism. Higher permeability leads you down a path of possibilities of damage to the brain. LPS increased in autism. The gut microbiome, or a less diverse gut microbiome, truly leads you down a path of more possibilities of autism. And those who do have autism have twice the amount of candida versus those who don't. This was fascinating in that here was a fecal transplant. So you're basically taking the bacteria from one organism and putting it in another. And there's a long story with that. And if anybody would love, you know, we can do a 5-minute video on what that is. Essentially, like I just said, you're taking the bacteria from one organism and putting it in another. And what they did here was they did a fecal transplant, and they saw improvements in gut health and autism symptoms, which seemed to persist long after the treatment. It was 2 years. 2 years after the taking somebody else's poop, if you will, 58% decline in symptoms tied to GI problems, and professional evaluator found a 45% reduction in core ASD, autistic spectrum disorder, decrease. It was about a 50% combined. There was an increased measures related to language, social interaction, and behavior. So this really spoke volumes to the idea of the gut plays a role, a possible role in those who are autistic, and the mom's gut also plays that possible role. The gut-brain connection in autism, up to 90% of people with autism suffer from gut problems. There's a gene mutation that affects neuronal communication in the brain that also causes dysfunction in the gut. That's been documented in May of 2019. Interesting how they have this novel personalized dietary treatment for autism. The first thing you can do is screen. So you screen, it's kind of like when somebody comes in our office, we assess. Screening is an assessment process. So what are you screening for? Wow, milk and wheat proteins. As everybody knows, who's ever heard me, I'm a big proponent of no dairy and no gluten. In addition, there was reactivity to dietary acuporins, including but not limited to milk and wheat, and always test somebody's gut profile, their gut profile pertaining to the diversity and amount of good versus bad bacteria, piggybacking on what we said before. Then you have a personal treatment formula. Step 2, now's your implementation. Here's your treatment. Patient-specific dietary restrictions, targeted pro and prebiotics. And we're going to go into detail on that. You've got to have the pre to feed the probiotic. And ultimately, you're going to check for physiological and behavioral changes. You're going to take a look at the gut microbiota, gut and blood-brain barrier, and any other inflammatory alterations. And you're going to look for differences in behavior like sociability and communication. So screen for gut problems and brain problems, treat the gut, see improvement. Chronic intestinal inflammation alters hippocampal neurogenesis. Essentially, what you're finding out is the hippocampus is your seahorse in Latin. It's where your memories occur. Brain-derived neurotrophic factors come from the gut to the brain. BDNF, as it's called, allows for brain neurogenesis. If the gut's on fire, you're never going to be able to heal your. So when we have brain issues, concussion, always have to have gut component with the component cost of communication. This study truly highlights that statement. So let's talk about the gut to brain connection, getting to the root cause of the broken brain. The gut to brain, very simply, 400 times the amount of messages from the gut to the brain than the brain to the rest of the body. Over 1,000 species. 3 pounds of bacteria in your gut, that much biomass, billions of bacteria in the gut. When you compare 20 million genes, 1,000 genes, with anything. There's more bacteria than cells in our body, and the gut contains more neurotransmitters than the brain. Gut to brain, again, the gut produces vitamins, digests foods, regulates hormones, excretes toxins, and produces healing compounds. So to treat the brain, once again, let this resonate, You must remove the cause of inflammation, such as leaky gut. This slide was fascinating, and so many times we've heard the term fibromyalgia. And we now know that fibromyalgia exists. It seems to exist more in women. It seems to be an elevation or oversensitization of the central nervous system. We do know the gut and the central nervous system are connected via the vagus nerve. Here it was studied that women who had less bad bacteria did not have the incidence of fibromyalgia, whereas where they had a larger amount of bad bacteria, women had a higher propensity to fibromyalgia. So again, do your normal treatments with those who come in with fibromyalgia, again, mostly females in this instance, and also to take a look at the gut. And I think that's a great example of gut to sort of a musculoskeletal issue that a lot of people have talked about, because fibromyalgia results have not really been documented to be positive. Here we have a great study by Aristo Vujjani, the father of immunology, and he said, we have the intestinal barrier and the blood-brain barrier, two immune barrier systems that have the same purpose, to prevent invasion, infection, and disease. Bidirectional signaling between the brain and the gut has been confirmed by numerous studies. This communication between the gut and the brain is ongoing from birth and plays a significant role in how shaping the brain is wired. I'm a big proponent. I do like to test. So if you don't have tests that are available, symptomology screens are great. Rob will supply them for you. The two things I'm looking at are to detect, I want to remove the triggers, because if I know what's triggering the injury, obviously we're going to take that away. And I always want to repair the barriers. So let's take a quick look at this. So you're seeing lipopolysaccharide. When you have that release of LPS, it implies that you have a leaky gut. If you're looking at occludin and zonulin are proteins that are expressed when you have damage to what we call the tight junctions, holding the epithelial cells together. When you have actomyosin expressed, actomyosin implies a true tearing at the epithelial cell lining. And then, of course, you have, and you would want to test for serum antibodies to see the length of time that you possibly have been producing antibodies. So let's take a look at this. Lipopolysaccharide, IgG, IgA, and IgM. They're expressed when you have an increase in systemic LPS or gut dysbiosis. Occludin and zonulin, IgG, IgA, IgM, you have a tight junction cell damage from stress, chronic gut dysbiosis, inflammation, and our good old friend that we want to avoid in our patients, non-steroid anti-inflammatories. Actomyosin, epithelial cell damage, chronic gut dysbiosis, celiac disease, IBD, IBS, and SIBO. Clearly, the damage at the gut lining is the most ruinous to the patient. So obviously we want none of these, but you understand as we're going from the right to the left side, you're seeing an increase in damage in time frame in which that patient will need to be treated. Systemic LPS is linked to multiple disorders. Multiple disorders, the one that I really want to highlight here is the release of LPS to the brain. Now you're really looking at the gut to brain axis. So here's a test that we get in America. I don't know if it's expressed or available in Europe. However, I just want to show you and give you an example. There'll be other labs that do this. What you're seeing is expressions of occludin, zonulin, and LPS. So when I get this test back, it tells me that there's gut dysbiosis, there's tight junction damage, and there's epithelial cell damage. This person's got the trifecta. They have a true sequela of gut issues. So one of the things, or my big takeaway, if you will, with the light bulb is, what would I want to do and what may I do differently than a lot of others that you've heard? Well, I'll pop these in. Intestinal barrier dysfunction, probiotics. We all know if we have an intestinal barrier, it's a critical element for good tolerance. An undamaged intestinal barrier is actually a prerequisite for almost every probiotic to be effective. However, an intact barrier actually can suppress all cytokine production. Unfortunately, probiotic treatment will not help It will not be as beneficial, certain probiotics, if the epithelial barrier is damaged and there's dysfunction, because it actually, most bacteria will pass that opening in the lining and increase inflammatory cytokines. So when a patient comes in and said, hey, I know I have this, I have that, I'm just going to, with my gut, I'm just going to take a probiotic, you may want to direct them to specific probiotics. There are two. The first one I'm going to recommend would be Aspergillosis, which is a yeast, and we'll go into more details shortly. This is my Super 7 action plan. My Super 7 action plan in a summary form says 1, reset. Reset what? Your diet, your lifestyle, and your mindset. So change their diet. Take out all inflammatory foods. Take away gluten. Do my GPS. No gluten, no processed food, no sugar. You take care of your DNA. No dairy, no nicotine, no artificial sweeteners. Let's avoid fried foods. Any food allergies or sensitivities they've been tested for or they know of, remove at this point. Change their lifestyle and their mindset, meaning make health wealth. Not ever been a better time in our history to really have that theme resonate now. Remove. Remove what? Unwanted pathogens. You're going to do so with oregano oil and berberine and garlic. Get the bad guys out, bacteria, virus, fungus, and the like. You then want to replace. You want to replace with needed digestive enzymes and stomach acids, pancreatic enzymes, etc., and bile. Regenerate. You want to regenerate the damaged intestinal mucosa. So essentially, you want to heal and seal the gut lining. You then, after using the Aspergillosis in something called Spore Probio, which is endospore, you then want to re-inoculate with quality pre and probiotics. Remember, you have to always have the pre to feed the pro. Reintroduce certain foods removed in step 2. Well, we called it a modified elimination diet. You eliminate foods other than gluten and dairy and the like. You may want them to try foods after that. If you're not retesting them, the retest will be in the introduction of foods. And if they don't have an issue with the food, then they're able to eat that food. I found out that if you take foods away from people and you don't offer some foods back, eventually they'll break and leave you. And ultimately, you want to retain your healthy GI integrity. You don't want them to go have a pizza in celebration. So reset. How do you reset? I'll go into a little bit more detail. You want to reset with anti-inflammatory diet, Mediterranean diet, decrease stress, increase exercise, get them moving, resistant exercises, body weight is great, flexibility. I'm a big proponent of MCT oil. MCT oil, which is something that we carry, is a great choice because it's a quality fat that also imbues the brain with energy. You want to add fiber and magnesium. Most people are fiber deficient. Magnesium also they're deficient, so you want to add those particular items. There will be a full protocol list at the end where you can go over the protocol and the product that I recommend. Till then, I'm just going to continue try and go over the information and explain to you how I present it to my patients. So again, let's avoid GPS, gluten, processed food, and sugar, and no DNA, no dairy, no nicotine, no artificial sweeteners. Now we get to the remove phase, where you want to remove offending substances in the diet. This is really the phase that's dealing with food sensitivities. You'll see about as many as 60% of the population suffer from undigested foods. Basically, your thyme, oregano oil are going to remove all your pathogens from your upper bacterial or your respiratory region. Berberine, which is for your train wreck patient, your dysbiosis, is going to remove everything from the bowel. And garlic is your true antibiotic, and it's also an anti-inflammatory benefit. The big hitter here will be berberine because your gut. You should use all three, but berberine is going to be the takeaway. Number 2, oregano oil. Oregano oil was very popular now with respiratory because of COVID-19. Berberine is interesting in that it stimulates the AMPK pathway. Activated protein kinase plays a role as master regulator of cellular energy. It works with the liver, pancreatic islets, adipose, and skeletal muscle. Berberine in this study was also shown to be antimicrobial and really help get rid of many gram-negative bacteria. Berberine also, just to piggyback, also showed to help with tight junction dysfunction. Berberine is a beautiful herb. I usually recommend titration of 2 to 3 months with 1 month off. And of course, remove. Remove what? Remove your bacteria because of garlic, antibacterial properties, antifungal, antiparasitic, and antiviral. Most people say detox or do the gut. I like to combine them together. I don't like to separate them. So a great part of removing is to remove by using your liver. It fights off infections, it neutralizes toxins, it controls blood glucose. It is your primary detoxification organ. It also produces bile, and everybody, your estrogen is detoxed in your liver. Not good liver detox, not good estrogen detox, leads you to a plethora of issues. So you must remember how well our body detox determines our susceptibility to disease. If we take in toxins quicker than our body can get rid of them, we're in trouble. Toxic overload is a silent killer. Now, this could take an hour. We are going to do a detox. I'm going to break this into details, and everybody needs to know all that can happen. But this is what I call a little food for thought. Basically, you're seeing how complex and how many nutrients you need to bifunctionally modulate, enable the liver to detox. Unfortunately, most Americans, most people in the UK have issues with their liver being balanced, and typically phase 1 is elevated and phase 2 is decreased. While the body has a natural protection mechanism to eliminate harmful chemicals and pollutants, there are instances when an individual may benefit from additional nutritional support, such as phytonutrients, to assist the body's antioxidant and detoxifying supports. That instance is right now when you want to fix somebody's gut. And I'll be honest with you, most people will benefit from a detoxification program. So much so in that detoxification program, I think it'd be brilliant that if everybody starts to consider when they go back to their office, who needs to detox, which will be the bulk of your patients. Think of that now. They've been home. They've been exposed to all the toxins, the molds in most of their houses. If you want to lose weight, if you want to get in shape, detox is a critical element. If you want the overexpression or the overabundance of chemicals, toxins, and pollutants not to get to your liver, detox is a great area. Once again, we're going to do a full hour on detoxification. Replace. You want to replace low gastric acidity. You want to titrate up. You can use betaine HCl and pepsin. In addition, you want to have pancreatic enzyme sufficiency by adding protease, amylase, and lipase. You want ox bile and taurine. These two are things that help in bile flow. Bile is a critical element. It is sort of the smooth, it slicks the intestines, it helps with cholesterol, and it decreases your incidence of SIBO. I might as well mention a product here because people are saying, well, A, B, and C, it's 3 products. Well, actually not. Digestive Complete has all of these in one. It's one of my most used products, again, which will be detailed right at the end before we leave when I share my protocol list. But I just wanted to let you know, don't be intimidated by this section. Regenerate. You want to regenerate. You want to heal and seal that gut lining. You're going to do so by using 1 or 2 different, what we like to refer to as medical type foods. L-glutamine, great for the gut, which I will detail in a moment. Apple pectin powder, aloe vera, okra, glucosamine HCl. Zinc carnosine, make note, got a slide on that. MSM, slippery elm bark, and really a takeaway in pro-resolving mediators. L-glutamine. L-glutamine actually has positive effects, including the maintenance of the gut barrier function and cell differentiation. It provides both a source of fuel and precursors for growth to rapidly dividing of the cell linings. It is the #1 L-glutamine amino acid in the body. L-glutamine beautifully patches gut injuries. Zinc carnosine, most people don't realize it, but it's an ingredient supported by dozens of scientific papers. It's actually known for its mucosal protective properties. Zinc carnosine activates the NRF2 signaling pathway, which is your master antioxidant pathway, which ultimately releases L-glutathione. And please make note, it lessens exercise-induced gut permeability by enhancing tight junction formation and stabilization. So for those who are athletic and exercising more than 2 hours, can damage your gut, zinc carnosine is truly going to prevent those type of injuries. MSM, so much discussion, but really excellent literature on MSM. MSM downregulates NF-kappa B. It also downregulates the expression of specific interleukins that are very damaging to overall health and tumor necrosis factor. MSM reduces clonal inflammatory markers, provides strong antioxidant benefits by increasing the level of the master antioxidant glutathione. Okra is a beautiful herb that has antioxidant properties that can also exhibit strong gastroprotective effects. What's omega-3 doing here? Well, we know omega-3 fatty acids are a great choice to anybody's protocol. However, omega-3 fatty acids also have a very potent effect in the gut. They do so by improving the biodiversity of the gut. The diversity of your bacteria in your gut is your superpower. By improving gut diversity and the number of species of healthy bacteria, your body now will have a lower inflammatory status and a lower risk of obesity. Omega-3 fatty acids are a standard that everybody should use, just in addition to eating a good quality, healthy diet. Alpha-lipoic acid works with the watery and fat part of the cell. It's shown to be anti-inflammatory and inflammatory bowel disease. It's shown to decrease inflammation by downregulating those cytokines and COX-2 inhibitors. The research showed that alpha-lipoic acid could ameliorate inflammatory damage seen commonly in colitis. Alpha-lipoic acid is what I call a hidden gem. I've seen so many people forget to consider this. It's also great for blood sugar regulation, and maybe it's good for blood sugar regulation because of its positive effect on the gut. Vitamin D should be D3 with K2, but the study was done with vitamin D. Vitamin D may increase the diversity of the gut. D3 actually has a positive effect on the richness of the quality bacteria in the upper GI tract. In addition, vitamin D is expressed in the gut and regulates epithelial barrier function and bowel inflammation, suggesting that vitamin D deficiency may actually directly impact bowel function and IBS symptomology. Pro-resolving mediators. The literature is robust. It's an interesting concept. It's really not that hard a concept. Just let's take these key takeaways. Fish oils, EPA and DHA, you want expressed. Omega-3s have positive health promoting functions. Arachidonic acid on the left side, omega-6, does not typically have health promoting functions. Fish oils are in theory supposed to convert to resolvins, protectants, and such. Because of the cytochrome P450 pathway, which is your detox pathway, and 15-LOX, which is a carbohydrate pathway, being inhibited in most people, taking omega-3s does not necessarily produce these resolvins. These resolvins are critical because they allow for the resolution of inflammation. In addition, they allow for the balance between the initiation, because we need some inflammation to heal, and the resolution of inflammation. So unfortunately, the recommendation, or fortunately, is take pro-resolving mediators, or PRM resolve. Do not substitute them from omega-3s. Take them in conjunction. One of the big takeaways with the pro-resolving mediators, or any true inhibitory anti-natural inflammatory, if you take NSAIDs or COX inhibitors, nothing you take will work because COX and NSAIDs shut off both pro and anti-inflammatory pathways. Then you want to start to reinoculate with probiotics. Reinoculating with probiotics, here's a list: B-lactis, L. celeriacis, Lactobacillus acidophilus, L. raminosus, and Bifidobacterium longum. Some of the main functions of the human gut microbes are, without question, to break down food, fend off pathogenic microbes, stimulate the immune system, protect epithelial cells of the gut, and synthesize vitamins. The mechanism, interestingly enough, of probiotics' effect on the central nervous system. So probiotics are able to communicate with the brain via the endocrine system, via the immune system, via neurochemical communications such as GABA and BDNF, the neural system, vagus nerve, and of course, short-chain fatty acids. So your gut is able to, through a multitude of means, talk to your brain, and many of the ways to talk can be increased positively by the consumption of pre and probiotics. Here's one of the probiotics that I recommend strongly, the form of it. It's called the Spore Probio. It's a spore, so it's found in the dirt and it has its own vegetation. It's delivered as a dormant spore. So the spore encapsulates this probiotic bacteria, which is called Bacillus subtilis. The endospores encapsulate beneficial bacteria to make them stable, have a high resistance to stomach acid, and more usable probiotics in the small intestine. It also supports health by producing a multitude of enzymes, secretory proteins, and antimicrobial compounds. This spore probiotic, Bacillus subtilis, because of its ability to form spores, protects microbes from hard conditions, keeps its shelf stable. You do not have to refrigerate it. That's a big takeaway in travel and refrigeration. This does not. It can stay at room temperature. In addition, it resists gastric acid, hydrochloric acid. It does not get damaged from your stomach acid, so you have very little to none die-off. Many probiotics have a certain amount of die-off, and it also is not adversely affected by pancreatic enzymes and bile because it's protected as a spore. It's shown to stick to the intestinal epithelium, and it stimulates the growth of good bacteria in the large intestine. Prebiotics. Prebiotics' effect on the microbiota. They've shown to decrease body fat, decrease truncal fat, decrease the release of interleukin-6, decrease triglycerides, which are blood fat, and increase bile acids. Prebiotics are critical. Now, what is a prebiotic? There's a lot of foods that are prebiotic. Fermented foods, garlic, onions, Jerusalem artichoke, leeks, and the like are a great prebiotic. There's supplemental prebiotics, which we'll get into also. The premise of the prebiotic is to feed your flora. You want to give digestible, fermentable fiber that encourages the growth of beneficial bacteria. It's a fertilizer that enables gut flora to thrive. It ferments in the colon, and it fuels the growth of probiotic microorganisms. The new kid on the block, the one that I recommend, all the literature points to this as one of the best, is XOS, or xylo-oligosaccharides. It's shown to grow probiotics at very low doses. The low doses are the amount of XOS you have to consume. It increases the growth of a good bacteria called Bifidobacterium. It's great for improving body composition, and it actually increases the length and the structural formation in the gut of the villi and its base. XOS resists digestion until it's fermented in the colon to ensure the increase of good positive bacteria, which is the Bifidobacterium that has been implicated in many studies. And by consuming XOS, you will not get any GI side effects like gas and bloating. XOS alters gut bacteria in both healthy and pre-diabetic adults. So by increasing the gut bacteria, you're going to have a positive outcome on those people who have good blood sugar and those who are on a path to have metabolic syndrome, a critical element. Just looking at COVID-19 for a moment now, I know this webinar is going to be on for perpetuity, and hopefully when many people hear it, we won't be discussing this, but the premise of just dropping 10 millimoles, which is not a lot, you guys use a different number, just by dropping 10 millimoles is the difference in outcome with those who have diabetes in COVID-19. So we know that blood sugar and insulin resistance are critical elements to overall health. The third item in the Spore Probio is bacteriophages. It has the endospore, it has the XOS prebiotic, and it has a bacteriophage. Phages actually were discovered about 100 years ago. But what happened was the doctors decided, because the adoption of antibiotics, they were deemed the antibiotics more effective and inexpensive because it killed all the bacteria. Phages are very different than antibiotics. They're actually positive for drug-resistant bacteria, and they actually help against what we call the long-chain LPS, that endotoxin. Bacteriophages are actually submicroscopic packages of DNA and RNA. We love to refer to bacteriophages as phages. They exclusively destroy a specific species or strain of bacteria. When you compare bacteriophages to antibiotics, antibiotics are referred to carpet bombers. They blow everything up. Bacteriophages are guided missiles only attacking what they're aimed at or what they're supposed to. They're very bacteria specific. Phages actually can coexist with targeted bacteria over a long period of time, a huge takeaway, whereas antibiotics will kill all bacteria. Phage-induced bacterial modulum impacts the gut metabolic health, and the phages can modulate metabolites that are positive for the host of mammalian host. They also occur very quickly. Their whole bacterial phage life actually can be completed in as little as 15 to 30 minutes. How do they work? Everybody always asks me that. Very simple. Look at the anatomical makeup. They have a head sheath and tail fibers. The tail fibers mediate attachment to the bacterial cell. The DNA is stored in the head. It travels down the sheath into the cell. Once it gets inside the cell, the phage hijacks the cell. It starts to make millions and millions of copies of itself. It engorges and starts to blow up that cell, and the phages burst through the bacteria, releasing more phages in the local area, killing that bacteria. So my take, or the way I like to explain it, is very simply, it's actually a virus that parasitizes a bacterium by infecting it and then reproducing inside of it and rendering it useless. Some other things that you want to produce, take. Good bacteria will produce this, and you can also take it in some of the medical foods, is called butyrate. Butyrate is a short-chain fatty acid of note that inhibits pathogenic yeast growth and enhances the functions of macrophages. Butyrate is that short-chain fatty acid produced by bacterial fermentation, providing many positive functions like ion absorption, immune regulation, intestinal motility and visceral perception, increasing cell growth and differentiation, inflammatory and oxidative stress, decreasing of course, and improving intestinal barrier function. Butyrate inhibits the growth of bad bacteria, decreases the incidence of obesity, has tremendous anti-inflammatory properties on the bowel, and reduces TNF and cytokine production. That was the end of phase 5, reintroduction of certain foods. So please, when you reintroduce foods, please again avoid, I know you've heard me say it, GPS, no gluten, no processed food, no sugar, DNA, no dairy, no nicotine, no artificial sweeteners, fried foods, of course, and any food you're still tested allergic or sensitive to. Retain. Well, obviously, we went through this whole process. Well, how do you retain your health? Very simple. Make diet, lifestyle, and your mindset something that you do every day. It's not a job. It is a lifestyle. So a good diet, obviously low inflammatory foods, low processed foods, and make it at this point individualized for that patient's genetic potential. Lifestyle, try and incorporate exercise, try and incorporate some sort of relaxation, talk about health. At this point, you always may want to consider a gut restorative formula. We'll go again through those when we go through the protocol list. Always take a probiotic. It all starts and ends with the gut, a probiotic that has a spore, bacterial phage, and a prebiotic. Help yourself with a fruit and green drink. It's very hard to get 9 to 13 fruits and vegetables through our diet, so you may want to, i.e., supplement with a quality fruit and green drink and collagen. Collagen is great because it helps with a multitude of different collagens that help the body heal. Gut, hair, and nails is also implicated. In addition, it's great for wrinkles. I know a lot of people come in and want the collagen and they just want to get rid of their wrinkles and allow for skin elasticity to continue through the years. So a couple of quick questions I know you're going to ask before I detail my Super 7 action plan. Most people ask, how long do those 7 R's last for? Well, it's all according to your patient's symptomology, testing, and injury level. So in theory, you can do each one for 1 month. Seems like a long period of time. You can also combine them. What I did do was give a 1 month super action plan. And the reason I gave the 1 month is if you've never done the gut before, it's great to do it in a month because you won't have the bumps in the road from patient compliance and certain things that occur. So this is your 35,000 foot view if you've never done gut right now with your Super 7 action plan. The one that I'll share with you just before we start to ask questions and answer questions will be your implementable on the ground starting point. So reset. You want to reset by taking Aspergillosis. It's a yeast that functions as a probiotic, therefore is not going to cause any damage or inflammation to the body if you've got leaky gut. MCT oil. We talked about MCT oil before. Medium chain triglycerides is a great choice for energy. It's fat that immediately imbues the brain with energy. MCT oil can be taken in a liquid form. Magnesium. Most people are deficient in magnesium. Clinical research shows healthy magnesium levels promote normal cortisol rhythms, help support relaxation, healthy sleep-wake cycles, great for blood sugar balance, great for musculoskeletal function and recovery, healthy cardiovascular function, and nervous system and relaxation. Spectrum AR, talked about that before. That's your oregano removal product. Berberine, Berberine Pro, and Spectrum BR. Berberine is in both of these formulas. You can pick and choose what you like. Let Rob Buxler guide you. He can guide you to the idea that it's damaging if it helps you if you have dysbiosis and removes all the bacteria in your bowel. Garlic Pro. We've always known garlic's healthy. I mean, honestly, it's kept vampires away. How much, but it is your natural antibiotic, antimicrobial. Garlic's a great choice and it has no odor in the supplement form. Dynamic Detox. Your Dynamic Detox, interesting, supports your body's natural detoxification processes, supports antioxidant capacity, supports energy production and vitality, supports healthy immune and gastrointestinal function. It helps you meet the needed micronutrient requirements to help you have a bifunctionally balanced modulation of phase 1 and phase 2 in the liver. And it contains 0 sugar. When you hear the detoxification webinar, you'll understand that sugar, without question, is adverse to having a positive outcome with detoxification. And now you're in the replace phase. As I told you before, love my Digestive Complete because it has stomach digestive enzymes, pancreatic enzymes, and also incorporates ox bile and taurine. So it's a 3-in-1, so you don't have to hand bottle after bottle after bottle to your patients. It's a one-stop shop. The Dynamic GI Integrity and GI Restore. I always, when I say 2 scoops twice a day, I like a scoop of each daily or twice a day. I like to mix them together. They are different. The GI Integrity is a comprehensive nutritional formula designed to support optimum GI health and function. The lining of the gut must have proper permeability and integrity so it can not only absorb nutrients, but also become the gatekeeper and promote healthy nutrition exchange with the bloodstream. Gut health is key to maintaining overall wellness. So it's formulated differently than the GI Restore. GI Restore is more a comprehensive mixture of amino acids, prebiotics, selected micronutrients, and antioxidant compounds. It is also gluten-free. It's looking to help with GI integrity, digestive function, and gut flora. So essentially, the integrity helps with the lining. The GI Restore restores the environment to the gut. Pro-resolving mediators, we talked about them before. They allow for the resolution of inflammation. Omega Pure EPA DHA 2400 is a liquid form that has a high dose omega-3s, tastes excellent. We all talked about omega-3s having a positive effect on body composition, gut biodiversity, and the like. Alpha lipoic acid, we talked about that earlier. Alpha lipoic acid, is the only antioxidant that works with the watery and the fat part of the cell. It's a great choice to decrease your incidence of colitis. D3 5000 with K2. D3 5000 is excellent in that we already saw their receptors in the gut to help with D3. D3 actually modulates and balances the different arms of your immune system. Spore probio, really detailed that earlier in that it's the endospore, has that prebiotic XOS, and has bacterial phages. Something new that I'm just introducing, a great choice, ultrabiotic daily multi. That ultrabiotic daily multi has a cornucopia of different bacteria to lead to a multi-strain, so it is able to populate both the upper and lower GI tract. You can take it with the Spore Probio. And again, this is a reiteration of the reintroduction of certain foods. You want to avoid gluten, processed food and sugar, dairy, nicotine, artificial sweeteners, fried foods, and anything that you're allergic or sensitive to. And here is your 1 month, this is your retain phase. In that you want to retain by using diet, lifestyle, mindset. You want to retain by doing dynamic GI restore. Talked about that before, 2 scoops daily. You can choose or combine Spore Probio and daily ultrabiotic daily multi-stream. Your dynamic greens is your fruits and vegetables. It tastes great. It's 20 fruits and vegetables. And of course, your multi-collagen renew. There's tremendous benefits to taking this. Let's talk about what patients want to hear. Healthy skin appearance, healthy nails, healthy joints, healthy bones, and supports ligaments and tendons. It's a great choice because when you look at it, you add it in your GI Restore with your dynamic greens. It starts your day with a health promoting infusion. Now, here's my Dr. Rob's 1 month gut protocol. 1 scoop of each of dynamic GI integrity and GI Restore 3 times a day. Yes, you want to just get in there and you want to fill that area with all those needed nutrients. In addition to that, pro-resolving mediators, 2 soft gels 3 times a day. Digestive Complete, 2 caps per meal. Spectrum AR, 2 soft gels 3 times a day. And of course, your S. boulardii, your yeast that functions as a probiotic. This is tried and true. This is what I use often in my practice. And this is something that I have matriculated to over the last decade with probably thousands of patients, combining myself and all the other doctors who have implemented this in their office. So we've got great empirical research combined with the scientific research based on the nutrients. So I hope you enjoyed the ride. That's my chauffeur. And I always like to end with a quote. The road to health is paved with good intestines. Hopefully you will be able to give your patients, yourself, your family and friends some good intestines. And if you guys have any questions, feel free to reach out to me at Dr. Robert Silverman. And of course, my Facebook, please like my Facebook. We're on every day during the week, Dr. Robert Silverman and our Instagram. And now we've got a couple of minutes. I'm going to open it up for some questions. And I know Rob will let you know about the next set of webinars. The next one we have is June 18th. It's a different time. They're all going to be from, I think, 7 to 8 o'clock. And the next one's going to be key nutrient protocols for the musculoskeletal system. So I'm here to answer any questions you have.
That's great. Thanks a lot, Rob. Fantastic talk today, as usual. Right, I've got a few questions for you. The first one: what lab do you use for your testing?
Okay, there's a multitude of labs, but the one that I had shown was Cyrex. You're looking, again, I'm not sure what you have. I use KBMO, and KBMO, actually the owner is from the UK. So KBMO has that ability, and I will send you, Rob, a link with the Dr. Rob code so they can get a discount to start.
Cool. We do have Cyrex actually. Regeneraslabs.com is a UK company that does Cyrex for anyone that wants to know that.
Yeah, I do use the Cyrex.
Yeah. How much zinc carnosine would you recommend for high level athletes? So someone training potentially 4 hours a day?
About 30 to 60 milligrams.
Perfect. If someone has developed gut issues, even after a long-term healthy lifestyle and supplementation, what would you look at? So would you delve into some testing, see what's going on?
Yeah, I'm a big proponent of testing. So let's go through the ideas of testing. I know Rob can give you a symptomology score, and that's great because the patient fills it out before and after protocols or during protocols. So you use their symptomology numbers. I like to have some objectivity if it's at all possible. So I use a lot of finger sticks in my office for food sensitivities. You can also send out for your different labs like a Cyrex for blood.
Cool. If you accidentally ingest gluten or dairy, will this have detrimental effects on your protocol?
Well, yes, I understand what you mean. You accidentally, you didn't know it was in there, or there was some cross-contamination. Everybody's symptomology response is going to be different in that. So for instance, if you have celiac disease, it's probably going to be relatively strong and relatively quick. If you have non-sensitive gluten sensitivity, it's not going to be quite as strong and quite as quick. The problem is, after you take the numbers, about 60% of people don't have either one of the two. So it can take up to 72 hours, 24 to 72 hours to see that symptomology, and they don't think or realize that the gluten adversely affect them. I'm not sure, Rob, you may be able to speak to this, but I think they're making a gluten blocker. And if they have one already, you may want to share it. If not, when it comes out, that'll be a great choice.
Yeah, we'll do it when it comes out. I think it's quite ready yet. Does the brain heal itself by taking care of the gut?
Yes, I always like to think that the body has the option of healing itself. I think you'll give yourself a much better outcome if you also fix the gut with the brain.
Perfect, and that's it in terms of the questions. So, so our next topic is, as you've said, Dr. Rob, on nutritional protocols for the musculoskeletal system on June the 18th, and you can register at nutri-dyne.co.uk/education for that seminar. Until the end of Monday, Nutridyne Europe are offering 10% off products at the Nutridyne Europe store. So www.nutri-dyne.co.uk. And if you use the code GUT10 at the checkout, that's GUT10 at the checkout, you'll get 10% off there. If there's anyone that doesn't have an account, again, you can go to our website, nutri-dyne.co.uk, and you can sign up for a practitioner account there. So all I've left to say is thanks very much again for your time, Dr. Rob. Great, and we'll see you in a month.
I look forward to it. Have a great day, everybody. Hope to hear from you soon.
Take care.